Welcome. I'm Alison Peat and I work in the Oncology Centre, one of the sisters in the department. What's going to happen at this session today is I'm going to give you an overview of the things that you need to know. You're going to have an individual talk with me to go through your specific treatment and any side effects you may get. There's also going to be an introduction to our Focus Information Centre. You're going to be going with one of our healthcare assistants to have your height, your weight and your bloods taken. Some people may be expecting to be offered some scalp cooling, which I'll talk a little bit more about later. But again, I'll tell you if that's your situation. Some of you might be having chemotherapy as a standalone treatment. Some of you might be having it alongside surgery. Some of you might be having radiotherapy as well. Everybody is completely unique and we would never be able to sort of compare each individual. So you won't all experience the same side effects. What I'd like to say at this point is if any of you have got any concerns at any point, please just always ask your consultant or one of the chemotherapy nurses. Please just re-ask any questions. We're always happy to help you. So what is chemotherapy? Well, chemotherapy is a drug treatment that we're going to give you that kills cancer cells. Cancer cells are in a position where they are rapidly dividing and they've become out of control. And so the chemotherapy will go and target those rapidly dividing cells. But what we also have in our body is normal, healthy, rapidly dividing cells. So these are things like your hair follicles, the mucosa in your mouth, so that smooth tissue you can feel inside your cheeks. That smooth tissue goes all the way down to your bottom. So your mucosa can be affected and also your bone marrow. So that's the substance in your bones that produce your white cells to fight infection, your red cells to stop you becoming anemic, and platelets that stop you from bleeding. So because those rapidly dividing cells are also affected, you may get some side effects. And I'm going to discuss those side effects in more detail as we move along. Some patients have what we call targeted therapy nowadays, and these are drugs that specifically can target onto the cancer cell, and they work by stimulating your natural immune system to fight the cancer. So sometimes you might have these drugs alongside our conventional chemotherapy. And when you come and see me on the one-to-one, I will be telling you if you're having these drug treatments. So before you have your treatment, it's very important we prepare you for it. So you will all have a blood test taken before your chemotherapy. So today you'll be having a blood test done. And then for treatments moving forward, you'll be having it within 3 working days of your treatment. Please don't worry today about when that's going to be. When you have your first treatment, the nurse will explain to you exactly when your next blood test is due. We do encourage you to have your bloods done at your own GP practice. And I know that can be difficult to get an appointment sometimes, but if you explain that you're having chemotherapy, they are usually very accommodating. If this is the case, we'll give you a blood form to take to your GP practice with you. So if your blood is okay, then we will be able to start moving forward to get you ready for your treatment. So the other thing we'll also do is you'll always be assessed by one of our doctors or our experienced nurses or a pharmacist. And this appointment for assessment may either be face-to-face here in our centre or over the telephone on a pre-planned appointment time. When you come in for assessment, you will be weighed. If you're on a telephone assessment, you'll be weighed on the day of your treatment. So we will weigh you every time. If we don't weigh you, please just remind us that you haven't been weighed. And if you find that you've lost or gained a lot of weight suddenly, please also tell us that so we can look into that a little bit more. So if your blood is okay and if you are okay, then we will move forward with your next treatment. So it is very important to tell us if anything has been concerning you since you had your last chemo. No sort of side effect is too trivial to tell us because we'd always want to try and make those side effects go away. It does get quite confusing when you're in for lots of appointments, especially at the beginning. So if ever you've got a confusion with the letters, things don't quite make sense, please just go to our receptionist and ask what is meant to be happening next, and they will point you in the right direction. So having your treatment, the majority of people have it here in our centre, just adjacent to where we're sitting now. We have 2 parts to our centre. One part is here. The other part is in what we call Cranham Suite, which is at the other end of the hospital. So when you check in for your treatment at reception, they will tell you whether it's going to be here or in the Cranham Suite. It's the same set of nurses that work in both areas. If it is in the Cranham Suite, we will be taking you to the Cranham Suite. Occasionally, patients have treatment over at the Edward Jenner unit in Gloucester, and sometimes patients have it as an inpatient on our wards, Lilybrook or Renken ward. We will be telling you where you're having your treatment as time moves along. So I'd just like to sort of demystify things really, because people don't sometimes know what to expect. When you have your treatment, you will just sit in a normal chair, either in a room with several other people or a small room with one other person. It doesn't matter which room you're in. It doesn't mean that something's different. It just means we're using our chairs to the maximum capacity. Each chair will recline, so you can have your legs up and be comfortable. You'll also notice that we've got this little machine here, which is a sort of an infusion pump. So most of you will have your chemotherapy through an infusion pump, and it does unplug and you can go out to the loo. You don't have to sit there for the whole time waiting for the chemotherapy to finish. You're welcome to bring things in with you. We welcome you to bring in music or books, just to pass the time. You're very welcome to bring in cold food with you, and we've also got a shop in our waiting room here. For people that are going to be with us for many hours, we do offer a light lunch, and all the way through your treatment, hot and cold drinks are provided by our volunteers. When you're having your first treatment, obviously you're going to be very anxious, as is your family. So on the first occasion, we invite you to bring somebody with you. You will see that we're quite tight for space in our chemo suite. So for subsequent treatments, if you can manage to be in there on your own, that's what we would ask you to do. However, if there's a special reason why you need somebody with you, we will accommodate your request the best we can. So everybody's treatment is going to be different. Some people are going to have treatment intravenously, and it might be very quick, just literally 30 to 60 minutes. Some people might be with us virtually all day having their treatment. And some of you might be having it by tablet form, or maybe a bit of both. So again, when you see me, I'll tell you how long you're going to be with us and how we're going to give it. The majority of people have their treatment through a cannula. So the cannula is a little device that goes into the back of the hand, it's a little plastic tube. As soon as the treatment is over, the cannula is taken out. If you're going to have treatment that needs to be delivered while you're at home as well, you'll have the pick. So this is a little plastic tube that is inserted usually into this region of the arm, and it will stay in for the duration of your treatment. And again, if you're going to be having a pick, I'll explain a little bit more about that when I see you. So as well as having drugs by infusion, sometimes you'll have what we call a bolus drug. So the nurse will literally sit with you and sort of inject the drug through the tubing into your body. So you may have a little bit of the nurse sitting with you and a little bit of infusion. So a little bit of both, really. So when you have chemotherapy, it should never hurt. You might find that it's cold as it goes into your vein, because sometimes we have had it in the fridge. But it should never sting or burn. There is a very rare complication where occasionally the chemotherapy can leak out of the little tube and go into the tissues instead of the vein. So if you feel your chemotherapy feels different or you're a little bit concerned about it, please let your nurses know immediately. Even if they look busy, just call out and say, can you come and check my chemotherapy? Because we want to be able to reverse that situation should that happen. It is very rare. So to explain to you how we organise our appointments, the majority of people have what we call a two-stop appointment. So you'll go and have your blood done, ideally at the GP practice, and that will be within 3 days of your treatment date. And then you come in for part 1 of your treatment appointment. So on day 1, you'll be assessed by our doctors or experienced nurse. This is when you tell them about any side effects you've had and how you've coped with the last chemotherapy. The doctors will be looking at your blood picture to see how your blood is, And again, so if your blood's okay, you're okay, we'll say, okay, come back in the next day and have your chemotherapy. So that's why we call it a two-stop. The reason we do it like this is because it can take a long time to do everything on the one day, and sometimes it is just too much for people. Depending on what chemotherapy you are having though, occasionally we have no alternative but to do it all on one day. And so you do need to allow the whole day. If we're telling you that everything's happening on the same day, it really is a full day's worth of treatment. We do encourage people, if they're having this sort of system, to perhaps go over to wait in our Maggies Centre over the road so you can be more relaxed and more comfortable. And I'll tell you about Maggies a little bit later on. So most of our chemotherapy is made up on site. It is quite a complex process to make it, which is why we do it the day that you're not here, so that when you come for your treatment, the drugs are all ready and mixed. If there are going to be little delays with the mixing of these drugs, we will try and keep you informed. So we have television screens in the main waiting room, which talks about a delay. We've also got a little whiteboard in our smaller waiting room, which the nurses will write up if there's any delays going on. So we do try and keep you informed as much as possible. We do have the option of giving some patients their treatment much closer to home. So we have this mobile chemotherapy unit. And it's exactly the same layout as in our treatment centre. We can accommodate 3 or 4 patients on the vehicle at any one time. Currently, the vehicle goes out to Stroud, Cirencester, the Forest of Dean and Tewkesbury. The benefit of using the mobile unit is that it is minimal waiting times. The parking is usually a lot easier. It's the same nurses working on the vehicle as they were as in the oncology centre, and it's quite a quiet environment. Now, not everybody's treatment is able to be given on our mobile unit, so later on this morning I'll be telling you if it's an option that we can explore for you. If you notice that you don't live in an area where the mobile unit's going, but you think you'd really like to have it on there, please mention that to me as well, because if you're prepared to travel to another area, that's something we might be able to offer you as well. Some people do that. They drive somewhere else because it's more convenient for them. Some people, as I say, do stay overnight, and if that's the case, we'll be asking you to ring Lilybrook Ward at 8:30 in the morning to check if a bed is available. When you arrive for your treatment on the ward, you will start off your care with a pathway nurse who will look after you until your bed becomes available. So your appointments for your subsequent chemotherapy, you will be sent an appointment in the post. Now, if you are concerned that you haven't received that appointment, I've given you the little booklet today on your clipboard, and on the back of this booklet is the receptionist number. So please ring that number if you're at all concerned that you haven't had an appointment through in the post. Please note that around bank holidays, we do treat people on Saturdays, and that's so that we don't give you a delay in your treatment. So, you know, if it is a Saturday, it's not an error. So that booklet is very useful for your telephone numbers. So I now want to talk about side effects, and I need to reiterate that everybody is completely different. And although I'm going to mention all these side effects, nobody gets all of these side effects I'm talking about. Some people really do get through chemotherapy very well. The first thing you need to know is that while you're having chemotherapy, we have a 24-hour helpline. It is available to you day and night, every day of the year. So again, on this booklet that I've given you, on the front of the book is your helpline telephone number. You'll also notice on the inside cover, we have written down your hospital number and the treatment that you are having. So when you ring the helpline, those are the details they're going to ask you for. So please keep this booklet somewhere safe. It's also very important to think about if you do need to access our helpline. Let's imagine it's in the middle of the night. How are you going to get into the helpline? It could be that, you know, you have a caring responsibility at home, so your partner has to stay at home to do the caring. You need to come into us. Think about your contingency plan. Who will bring you in? How will you get into us quickly? If you've got nobody to bring you, we can send an ambulance. But really, the quicker you get into us, the quicker we can work out what's going on and what the problem is. So think about that. So when people say, what can I do to help? maybe they can be your transport plan. On the back of the booklet, we've written down there's a space for you to write down people that can help you. It sounds a bit crazy at this stage, but if you're 3 o'clock in the morning, you can't think straight, you're feeling unwell, you want a telephone number of your friend that's going to bring you in quickly, there's the number. So please write those down in advance so you've got a plan. So getting help and support is really important. Please don't wait till the morning to ring us on the helpline because you didn't want to disturb anybody. The nurses are there literally day and night and they will take your call. The quicker you tell us you're feeling unwell, the quicker we can work out what's wrong with you. When you've had chemotherapy, you can be overwhelmed with infection quite quickly because your immune system isn't working as well. So the quicker you get into us, the better. Sometimes our helpline number is busy. If it is engaged, please keep ringing it. It will be answered. It's just literally there's other people on the call. It's not that there's nobody there. If you've got a real emergency, it's life-threatening, you would ring 999. So when you ring the helpline, as I said, you've got the details in that leaflet that I've given you. So have your details ready. The nurse will go through all your symptoms with you in a systematic way. So they will be working out what the best plan of action is. You may well be asked to come in, and some people will come in and be admitted. Some people come in, they're checked over, and then they go home again. So it really does vary. So the other thing I've given you this morning is your little red card, the chemotherapy alert card. This is very important to keep on you all the time. So keep it in your purse or your wallet. Again, on the alert card, you've got the helpline number, and inside the card, it's got your hospital number and the treatment you're having. So again, if you're out and about and you feel unwell, you can ring the helpline with the information we need. Sometimes people are given a little green card, but today that's not relevant to any of you. Please show that card when you go to see any other healthcare providers. If you go to your GP, your dentist, anybody, if you have to go to emergency department, show them that little alert card so that they can contact us in case it's relevant. So when you have chemotherapy, because the chemotherapy is affecting your rapidly dividing cells, your bone marrow can be affected. So usually about 7 to 10 days after you've had the chemotherapy, your bone marrow is less effective. So within that time range, if you have a temperature above 37.5 or below 36, and you might have flu-like symptoms, please ring the helpline. All those parameters are in your booklet. So everything I'm saying from now on is written down in your leaflet. Okay, so you don't have to memorise all this. The one thing we ask is that you go out and buy a little digital thermometer. If you check your temperature while you're well and you know what your normal temperature is, if you check it when you're feeling unwell, then you can tell us if there's a sort of a differential. If you're feeling unwell, but your temperature's your normal, please still ring us on the helpline. It isn't always the temperature that we have to be guided by. It's how you feel in yourself. If you're not feeling right, we'd much rather you ring us on the helpline, tell us how you're feeling, and we'll decide what the plan will be for you. To try and protect yourself while your immune system is low, please just avoid people with colds, coughs, chicken pox, things like that. Avoid public transport at peak times, and just simple things like washing your hands before you eat or after you've handled your pet, just to keep your sort of self as safe as possible. Again, because of these platelets we have in our bone marrow, if that platelet level is diminished, you may notice you get some new bleeding or bruising. So anything new that's unusual for you, so bleeding gums, rashes, big bruises, please let us know on the helpline. Just to help prevent bleeding, we would recommend you use a soft toothbrush, use an electric razor, and avoid contact sports while you're having chemotherapy. So again, because of these rapidly dividing cells, the mucosa in your mouth and to a certain extent sort of going down here in your sort of gullet area, it may become sore. So It's very important you establish a good mouth care routine now. So we recommend you brush your teeth twice a day using a soft toothbrush. Use a plain or saltwater mouthwash after meals. So that's just like 1 teaspoon of salt in just a little cup of water. Maybe warm water is good. Swoosh it around your mouth and remove any food debris that could have collected in your mouth. If your mouth is sore, we definitely recommend you then use your salt water 4 times a day and ring the helpline for advice. We also recommend using soluble paracetamol when your mouth is sore, because you can sort of gargle that in your mouth and then swallow it. So if your mucosa is sore in this region, it's going to help the pain here as well, because we don't want you to stop eating. We don't recommend the over-the-counter mouthwashes, things like Corsadil or Listerine. They're very, very strong if you've got a sore mouth. They can make it quite sore, and they're very expensive. Saltwater mouthwash is one of the best things to use. People really get concerned about whether they're going to feel sick, and the answer is no, not everybody does get sick or feel sick. So we always give you anti-sickness drugs before your treatment, and we give you them to take home as well. So if you found that after your treatment you still felt quite nauseous, or you perhaps vomited 1 or 2 times, it wasn't very nice, when you go in for your next assessment, just let your doctor or nurse know that it was difficult, and we will up your anti-sickness drugs. We start off with a standard approach, but we can always go higher. If you are feeling a little bit nauseated, just please try and eat little and often. Just keep something in your body all the time. But if you continue to vomit or feel sick and it is of concern to you, please ring the helpline. Unfortunately, some of the drugs that we give you will cause diarrhea or constipation. So if that is becoming a problem to you, again, let us know. If you have more than about 4 episodes of diarrhea in a day, again, please ring the helpline. We don't want you to get dehydrated, so please ring us if it is becoming a problem. We'd much rather you tell us about it than struggle on at home. Please keep yourself really hydrated. Drink plenty of fluids. We're all meant to drink around about 2 litres a day, so teas and coffees and sort of waters or juices and things like that. The one side effect probably everybody will experience to a certain extent is tiredness and fatigue. Some people do get very tired during chemotherapy, but we know that if you have gentle, regular exercise, it really does help. So when you go into our focus centre this morning, Ali will be able to talk to you about safe exercise groups that are available. Lots of people really benefit, and people that have had chemotherapy have said they wish they'd known about exercising during chemo rather than not exercising. So it's something you might want to think about. If you already do exercise, then you can keep it up to the amount that you can tolerate. We have lots of information on managing fatigue in our focus centre and at the Maggies Centre. And if people are offering you practical help, just accept it while you're going through your treatment. So again, because of these rapidly dividing cells in our body, our hair follicles can sometimes be affected. So some people will experience hair loss, and it will start about 3 weeks after the chemotherapy has been given. The hair does always grow back after treatment. So when you've had your last lot of treatment, within about 3 weeks, it starts to come back again. So I will be talking to you about how we can support you and whether scalp cooling is appropriate in my one-to-one with you. Will chemotherapy affect my fertility or sex life? Well, your libido will be affected. You will be feeling fatigued, so your libido will be reduced. Very important not to become pregnant or father a child whilst receiving chemotherapy. And for health and safety reasons, it's very important to use a barrier contraceptive during your chemotherapy time. If you want more information or more sort of intimate sort of information, there's a lady called Samantha at Maggies, and you can book an appointment and go and ask her more detailed questions. Eating and drinking. So we absolutely say to you, please do not cut out any major food types unless you've been advised to by your consultant or a dietitian. Please just aim for a healthy, balanced diet. Maybe little and often, drink plenty of fluids, And again, we've got lots of dietary advice in the Focus Centre. So we've got lots of sort of recipe books and things that, really help you to make the calories count when you need them. If you are on any other medications, please let the doctor know. And we've asked you today to write down any medications that you're on. Sometimes drugs can interact with each other, and even with some of the sort of herbal remedies that you may be sort of deciding to take, please let the doctor know before you start taking them. Can I drive after my treatment? Well, on your first treatment, it's very sensible to get a lift home because you're not going to know how you feel. A lot of people do drive home after their treatments, but there's a few people we give, for example, intravenous Piriton to, and that does make them quite sleepy. So, work out how you feel after your first treatment and then make a plan. We can give hospital transport, but we encourage you wherever possible to use your own transport, because if you are on hospital transport, you'll be waiting for other people to finish too, so you might be hanging around for quite a while. So other things you need to know, if you need any dental work doing, ideally get it done before you start your treatment. However, if you start to have problems while you're on chemotherapy, please ring the helpline and just tell them what the problem is. When you go to your dentist, show them the alert card that I've given you today. And it may be that we've already had to do a blood test on you to make sure that you're okay to have that dental work. For ladies, we ask you not to use tampons while you're having chemotherapy, and that helps to reduce any risk of infection. And for anybody that's having a line put in their arm, a PICC line, we say, please, no swimming or hot tubs. So vaccination advice. During the winter months, most people we recommend to get a flu jab. There is a small group of people that don't have the flu jab. That doesn't relate to any of you today, so we do encourage you to have your flu jab, and anybody that lives in the house with you as well. For other vaccinations, there is information in the booklet I've given you today, and if you wish to discuss any of those vaccinations with your oncologist, please do so at your next consultation. Don't have any vaccinations without discussion with your oncologist. So we've got lots of ongoing support and advice available for you. So we have the Maggies Centre, which is literally about 5 minutes over the road, adjacent to the fire station outside this building, and our receptionist staff can point you in the right direction. So it's open Monday to Friday and on alternate Saturdays. And you've all got a booklet on your clipboard today about Maggies, and there's a Maggies timetable in it as well. You can just drop into Maggies, no appointment needed. We certainly don't need to refer you. And what I'd recommend is that everybody just goes into that area once to see if it's for them or not. Lots of people find it very, very supportive. So this is the Maggies Centre. There are 3 support nurses over there and also a psychologist. So if you want to go and talk to somebody, they are there for you. And as I say, no appointment needed. For people that might be Gloucester-based, we have the Maggies Centre, open Monday to Thursday. And again, it's a drop-in centre. So if you want to know a little bit more about any of these things I'm telling you, when you go into Focus, just please ask for a leaflet on Charlie's or whatever it may be. And for people who live out in the Forest of Dean area, we have Great Oaks, and again, a drop-in facility. So in summary, what can I do to help myself? Please drink plenty of fluids. So as I said, try and aim for at least 2 litres a day. You can have alcohol in moderation, that's fine. We probably just don't recommend it the day before or the day after chemo. A healthy, balanced diet, so just little and often. Try and do some light exercise. Even if it's just a walk around the park, it really does make your body sort of respond better. Good mouth care, so salt water mouthwashes. When we do start to get a bit of sunshine, protect your head from the sun, so using a high factor cream or wearing a hat. Please buy a thermometer and don't go it alone. We are certainly here to help you. The Focus Information Centre is here to help you. So if we haven't answered all your questions today, just come back and ask again or ring the Focus Information Centre. The numbers are on the leaflets. So finally, The booklet that I've given you today is probably the most important booklet you're going to get. It's got your helpline number on, and it's got the signs and symptoms to look for if you're starting to feel unwell. Please don't delay ringing the helpline. Don't try and sort of solve the problems yourself or ring your GP. Ring us, because we are the experts and we know exactly what treatment you're having. So please always ring, day or night.
My name's Ali and I work for the Focus support team, and we're here to help you with everything else other than your clinical treatment whilst you come through the centre. So we are funded by the Focus charity, and we're open 8:30 to 4:30 Monday to Friday. Anyone's welcome. The space is there for you. It's your space. We stock lots of information on all the different types of cancer, but also issues that you might trip across as you're coming through the centre. So it could be travel insurance, fatigue, it could be something to do with side effects, alopecia, anything at all. We have got information available for you. Also, whilst you're receiving chemotherapy as an outpatient, we offer you a permit for the car parking. So it's not any car park in the hospital, it's just the oncology car park, which is out the front of reception here. The permit will be issued to go with the patient, so it could go on any vehicle, and it will last 3 months. We just ask you that at the end of 3 months, if you're still on treatment, come into the centre with your chemo alert card, the red and white card with your hospital number on it, and we can issue you for another permit for another 3 months, and so on and so on and so on. There are 50 bays. It does get busy, so sometimes we recommend that someone, if they're coming with you, they can hunt for a bay and drop you, but they do come free, so do persevere. For your convenience, on a Tuesday in the information centre, we also run a wig clinic. So if you're likely to lose your hair, or if your hair thins as a side effect of your treatment, we offer you the option of a free consultation for half an hour with a wig consultant. There's no obligation, you can just see how you feel with it. The appointments are pre-bookable. If you don't want to go ahead with it, no worries, I'll just rub the name out. We've got 100 wigs in stock, so many people leave with something the same day, or we can order things in. There is a charge at the moment for prescriptions. It's £70 and 15 pence currently, but it goes up with the budget, unfortunately. The NHS exemption certificate does not give an exemption for the wig because it's not a pharmaceutical prescription, but you may be eligible for an exemption if you're in receipt of means tested benefits. So we just take it on a case-by-case basis. We also in the centre offer sleep hats for comfort if you lose heat at night, and bamboo headwear because it's soft and gentle against the scalp. One other thing that we're offering at the moment are 6 complimentary therapy sessions. So these are to aid relaxation and sleep. I'm afraid they're for the patients only, but they're really popular. So we can offer you gentle head and neck massage, Indian head massage, reflexology. There's a volunteer currently working today offering reflexology, which is fab when you're on treatment. Shiatsu, which is like an acumassage. EFT, which is an emotional freedom technique. So if you have racing thoughts, they can help reprogram them and help you regain your balance and get calm again. And what else do we have? And Reiki. So it's the non-contact energy work. You can take 6 complimentary treatments and book them entirely when it's convenient for you. What we do is we phone you the day before to see if you're still feeling up for it. If you're not, and you just say, actually, Ali, I don't feel up to it, I'll just rub your name out because they're just meant to aid relaxation and sleep. Also, I know that down the road you've seen the sign for Maggies. Maggies are a fabulous source of support for all of you. There are support groups, but there are also 2 key things that we really recommend. The patients recommend them as well. For ladies, it's called Look Good, Feel Better, and it's a pampering session, and it is what it says on the tin. The ladies who go there, when they come out, they look good and they feel better. And it's all the big makeup houses like L'Oreal, Yves Saint Laurent. They donate products. The Look Good, Feel Better team make them into kits. They invite 8 patients at a time, and you cleanse, tone, moisturise, apply eyebrows, and you all help each other and then you keep the kits, and they're worth about £250. But there's also a session for gentlemen now, and it's the skin fitness programme, and they teach you how to look after your skin in the sun, and if you're grooming, and also with scarring, and they likewise give you a kit to keep. I think it's got Chanel shower gel in it, so it's very popular. They invite 10 gentlemen at a time. At the moment, they're running 3 Wednesdays out of 4, but there is a little bit of a delay, so I recommend you get your names down because it's something good to look forward to on the horizon. And finally, just to let you know, we've got very generous people who donate paper books, second-hand books, jigsaws, DVDs, and we just ask, if you take one, would you mind putting a coin in the charity bucket? And that's everything. Thank you very much for your time.